This is a smile procedure on a gentleman having LASIK in his fellow eye. This is the Zeiss VisuMax laser. We really want to get good centration because the femtosecond portion, unlike in LASIK, is the entirety of your centration. You do see a little bit of fluid into the suction areas near the limbus, and you really want a dry fornix when you do this procedure. First, the posterior cut is made, and you'll see next the side cut of the lenticule, a small flash of the outer ring, there it is. And now the anterior cap cut is made from central to peripheral. And lastly, you'll see the 3 clock hour superior, but in this view inferior, because this is a superior view, incision. When the incision is opened, it's important to typically delineate the anterior plane first, as you'll see, making very sure that the correct plane is dissected, and then a posterior plane, and I tend to use the other side of the incision for the posterior plane. Once there's a good reflex of the reflection off the edge of the lenticule, and that you can clearly see that overlying the hook here, I then go to the right side and sweep left to further open the anterior plane. I will dissect the anterior plane first. As you can see, there's a fair amount of resistance, even though we got good laser coverage. We want to make sure to get all the way peripheral for a complete dissection. You can notice that the elbow moves opposite the spatula head in an effort to avoid side tears of the smile incision. And now the posterior dissection, which is a lot more crucial because you want to maintain countertraction as much as possible. And the central portion is always done first, because if there are any tags left, you do not want anything to be as close to the visual axis as you can avoid. And then you'll see carefully breaking the side cut, and you can see where it kind of pops out. And you'll notice that each of these sweeps from where it is attached to where it is not attached. And this is based on Susan Jacobs and many others' excellent findings of the importance, again, of traction and countertraction to reduce the likelihood of having a tear of the lenticule with leftover remnants. And you can see the lenticule is nicely free. It will be removed. If there's any resistance, don't pull, but it obviously is very smooth with a complete dissection. Sometimes it's helpful for the lenticule to be moistened in order to unfold it and make sure it's perfectly round with no missing portions. And you'll see that it unfolds nicely. There are certainly variations in practice patterns with respect to irrigating within the smile pocket or not. I have found that with some irrigation and then smoothing of the cap back from inferior to superior, as you'll see here, that we get a quicker visual recovery. And the patient has done very well.